Expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Gereatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay. Good morning, Dr. Mencia. Well, we have a whole group here. You call it your family.
Oh, yeah, La Familia.
Yes, La Familia. So tell me who we have here.
Caitlin Ferguson.
Yes, Caitlin Ferguson.
Yeah, Ferguson is a dentist that had joined us and been with us now for a month or so?
Yeah, a little over a month now.
Over a month. My patient love her.
I mean, I can see why.
Not only that she's gorgeous,
right,
but she's an excellent dentist. So I'm so happy. I mean, I tell you all the time. You know, we get so many people. I have seen Mike can tell you. Mike is here with us, our manager, executive manager,
right?
Because he's going to be managing both offices.
Ah,
yeah.
So he's the guy.
So he's moving to the executive level.
Yes.
And Mike can tell you how many dentists we have interviewed and looked at. They have come by, and you know, we all sit down and we say, you know, the type of practice that we are running, we don't think that person is going to fit in. Either, you know, they are not a team player. But with Caitlin, we have hit goal. We are so happy. The patient love her. You know, they are happy to come back and see her. Highly educated, very well trained. So
can I ask her a question?
You can ask her a lot of questions, but we cannot forget Ina Leskovi, our office manager. Yeah, we cannot. Dobre utro. Dobre utro.
That's Russian. That's Russian.
So she can talk to all the Russian.
No, but one thing I've complimented her.
Don't talk to Putin. No.
Leave
him out.
Don't talk to Putin. But I have complimented Dr. I've told Dr. Mencia many times, if I want something done, I find Ina, and it gets done.
Absolutely.
And, no, I mean, absolutely. I really, I don't want to know when I call. Well, who do you want to talk to? Ina, please get her on the phone for me. Anyway, may I please ask Caitlin a question? Caitlin, what made you become a dentist? You probably could have been anything.
So I knew I loved science, and I knew I loved working with my hands. You know, I considered like various medical professions and different things, and I actually happened upon a job while I was in high school with Dr. Tite. Maybe some of your listeners remember him. He was a wonderful orthodontist, wonderful man, and so I worked for him for a year, and after that in high school, my senior year in high school. And then so I went into college thinking, you know, that was a really cool profession and something I wanted to pursue.
And, you know, it's interesting because we always thought of women being the hygienists. I mean, women weren't the dentists, right?
Exactly, absolutely.
That's what you want to be, right? So, Dr. Mencia, when did that all change?
Well, I would say around the 80s, late 80s. That's when it really took off. Because I remember in the early 80s, women going into the military, they were having a hard time being accepted by the counterpart that were serving in the military. So, you know, imagine outside the military in the profession. And Mike, you were in the Navy, you know that.
We only had one female on the entire base in New London, Connecticut, and that's who I work with. I remember her name was like Elizabeth, but it was the only female in dentistry. And that was
Elizabeth Taylor?
Yeah. And it was in 1974 to 77. I only knew one female those entire 4 years. You know, so it was a tough profession. Now, of course, I think it makes up about 40% probably, I would think.
And I tell you, Anita, a lot of the old-timers, when they come and, you know, we get a lot of students because I teach for Nova University and most major universities in South Florida, they rotate through the center. And when we get a female student rotating with us, usually they will ask her, are you a nurse? And she say, no, I'm a doctor student. And a male that will come in to rotate with us as a nurse, usually they look at them as a doctor. So even for the old-timer, they still adjusting to those changes.
Well, I have to add to that. I had an orthopedic surgeon who was on my radio show down from the University of Miami. Tall. She's from Sweden somewhere. She's fantastic. And she said all the time, she's in the hospital and they want to know when the doctor's coming in. And she says, I'm the doctor.
Yes.
She has to do this all the time. But it's we're getting rid of all that, aren't we? Okay, so Mike, let's just give you a chance here because, I have had you on the show before and things are increasing. And let me ask you this. Why, years ago, when I went to a dentist, there was the dentist. Why do you need now a person managing a dental office?
Oh, there's so many different procedures today. It's just a busy profession now. People are getting fixing their bodies. The mouth is a big part of that. So there's a lot of different phases of dentistry. We'll talk about the sleep apnea, but there's so many different phases of it that has to be managed in a way where it's going to flow. And that's what I do. When you come over to the office.
No, I know about you. I just want everybody to know
and
that.
not only that, also a lot of times you get a job and they give you your medical insurance with a dental attached to it. And people don't understand what is covered by dentistry. And the management department, because, Caitlin and I, we don't know about insurances. Right. We cannot tell the patient, you're going to get this much from the insurance, where that's his expertise. So the Anderson and Mike, they will come in and they will look how much money can we obtain from your insurance before you put anything out of your pocket. So that become very useful for the patient also, because a lot of times you go to a dentist. I get so many of my patients that come to the medical department and they say, well, I got a bridge, I have this, and then I open my chart and I say, but do you pay? They say, yeah, I pay cash, but you have insurance. And one of the things we're going to remind people in December, like we always do in our program, one of the things, if you have dental insurance, you have until the end of December to use that insurance. Otherwise, you lose all of that money that you have collected throughout this year. And starting January 1st of next year, you start back from scratch. You start all from zero. So it doesn't accumulate. It doesn't carry on to the following year. So you have to use that money that you have there. And a lot of time when they come to us, they might need certain work, like they might need a cleaning today, some filling next time, a bridge next time, a root canal, and then the manager is the one that will organize, stratify this so that things are done on the proper order.
That's a very good explanation. I appreciate that. Caitlin, I wanted to ask you, though, about this. You're new in this, in a sense, but years ago, I don't remember insurance for dental. That was always the stupid thing is, what do you mean you don't have insurance for dental? Why do you think that was?
I think it became such a burden for the patients because as overhead, even like educating the dentist got more expensive, the staff and all the overhead has increased more and more. So it, and to an extent that had to get passed on to the patients. And, they came up with these insurance plans to help people get what they need and help them pay for it.
Well, so when you went into this field, I'm sure that you had great expectations of certain things. I mean, and I think Mike just brought up the fact that the people that have sleep apnea, probably they never talked about that when you were doing, I mean, maybe they did because you're pretty new at this, but I mean, years ago, sleep apnea was a medical problem. It wasn't
Absolutely.
a dental problem, right?
Yeah, and it's really, in the last few years, really grown a lot. Yeah, it wasn't something they covered in dental school with us, and there's a lot of things. The wonderful thing about dentistry is, you really want to be someone who likes to learn to go into this field because it grows and it changes, and, I'm fortunate that I love to keep learning and keep learning about all the new wonderful things that we have out there for people.
Dr. Mencia, so as a geriatric physician, there's quite a difference in a personality for a dentist and I think, in my opinion, maybe that's not true, but a physician such as yourself, and you're a rare person anyway, and we know that, but typically a dentist is just different than a medical doctor. There's something, it changed a personality, because remember, you're in someone's mouth all the time, right? And so, I don't know, psychologically, you're very good at this. Help me try to explain, what is that?
Well, you have two types of dentists in my book. You have the dentist that can only see when the mouth is open, and then you have the dentist that can see the entire patient. And in our center, we work with the dentist, the whole dental department, that when that person is there, you don't look into their mouth first. You get to know the person, and it's not the cavity that you are having. It's not the problem that you are having when you drink cold or when you drink hot. That's not the problem. We want to get to know Anita Findlay first. Okay, so you're going to be on the radio all the time. You are talking to people all the time. And then when we get to your immediate problem, we try to fix that problem. But then, a cavity has a biopsychosocial component.
A cavity has all those things? Oh, it's not just a hole in the Grand Canyon.
It's not a little hole in there. Biologically, we know how that cavity came to be. Psychologically, if it's a lawyer out there that have to go to work, it is so important versus a person that is working carpentry up in the mountain and cannot come down until 3 months from now. So the cavity will take on a psychological component, biological component, and financially, if I need work that is worth $1,000, but the immediate care right now is only $75 or $150, we will stratify that for you and say what you need right now is only this much, and your insurance will cover all of that. And this is how much money you have left in your insurance, and we can do all of that. And then we create a relationship with the patient. Dr. Ferguson and I, we just had a patient that came in with Dr. Steve also, and the patient wanted to go under anesthesia. So Dr. Rosemary was there, Dr. Caitlin was there, Dr. Steve was there, and I was there, and the anesthesiologist was there.
You mean for the dental work?
For one patient.
And dental work.
Right. So everything got set up. We took a back step. Dr. Steve stepped in. He did what he was doing. I stepped in to make sure the patient was put to sleep in a safe manner. And then I kept just monitoring how many dental office you're going to go to, that you're going to have a team of people. Even you have one dentist working on you, you have a whole team of people working out there to help out, so that when you go under anesthesia, you go in and out very fast. We don't want, when you have one dentist, and sometimes you have the worst scenario for me, is when the dentists, they do their own anesthesia. That means they'll go ahead and they'll put you to sleep, and then they go and start doing their work. And the same thing happened with the plastic surgeon, by the way. There are plastic surgeons that will put you to sleep, and dentists that will put you to sleep, and then they go and do their work, but they cannot watch the monitor when they are inside the mouth.
They don't. By law, they don't have to have an anesthesiologist there?
Well, that is changing, but by law, no, they don't have to. They can still, if you are qualified to put the patient to sleep, then you can do both.
That's not good.
And I don't think that is, safe for the patient. Safe come to me above everything. And Mike can tell you, we have put so many people under anesthesia, and thank God up to this point, we have not had any kind of complication, because I'm always there. And my anesthesiologist, he's very, he say, unless Dr. Mencia come and look at the patient, I'm not starting anything.
Excellent.
So even before he put the IV, before he start the line on the patient and start giving fluid, he want me to check the patient, check the monitor, look at the heartbeats, and look at the saturation, how the lungs are working. And then he said, okay, I'm good to go.
Fantastic. Mike, it's a good time, I think, for you to explain something. When you first started there, if I'm not mistaken, it was pretty small. I mean, you have grown this department. I know. You have really grown this.
He's a horse.
Yeah.
I mean, what do you attribute this to?
Oh, I've been doing this a long time, and when I came out, this is my 4th year coming up, and I remember when we had the talk with Dr. Mencia and Dr. Rosemary, we had a vision where we wanted to take the practice. And if you remember, we've had maybe a couple of hundred charts, and now we're up to 3,700 charts. It's just, he had a vision, and I was very experienced with what I do, and we worked together, just like we're opening up a second branch now. That was one of the first things when he interviewed me, Dr. Mencia. He had this vision about expanding his dream. 4 years later, this is about to happen in the next couple of weeks. We'll open up a second practice.
It's going to be in Boynton Beach, and we're going to be telling you about that. So we're going to give you the date for a big grand opening, but just save the date yet. We don't know the exact date, but But Mike, just carrying on this, I know there's something you're very excited about talking about, and I don't want to run out of time. So, tell us about this.
Yeah, what we're
what's known
doing
as
now in the
sleep apnea.
practice, again, it works with medical and dental, is a lot of people have sleep apnea. Now there's something the last couple of years, an oral device. We particularly use something called the Moses device. People who have to wear a CPAP machine that are intolerant, I would say 90% of them said they can't wear it. Now a dentist only can make this oral device. Dr. Mencia will see his patient. He has to write the prescription. He'll see that this person has trouble sleeping, snoring. There's so many different things. Once we send the patient for a sleep study and it's read, they will recommend certain things, either a CPAP machine or an oral appliance, and this is great. We've been doing these, and people were getting great results. You don't have to travel with a machine anymore. It's just an oral device that opens up the airway. It's just fantastic now. And again, this is part of dentistry that's growing. This is the next phase.
That's the beauty. I mean, people with sleep apnea, because I see so many of my patients in the medical side of the practice that have sleep apnea, and they have this machine that when they travel to go and see their kids and their grandkids, they have to carry that machine with them.
Right.
And if they are going to a wedding, it's kind of cumbersome to try to bring all of that.
And just think at home, your sleeping partner listening to that thing all night long.
And I usually follow up. Well, I follow up with my patient after we started doing this at the in the dental department. And there is one guy that convinced me. He's an engineer, and he has the machine. And he got the device, and he said, Dr. Mencia, what a difference.
Yeah.
And he just carried, and with his company, he had to travel a lot. And he said, I just put that on my briefcase, and he's going to order another piece to have two of them.
I'm going to give, because I have a lot of questions to ask about this new device, but I want to give everyone the phone number to call for.
954.
Yeah, we have, you know what, now that Robin Williams is not here anymore, I think we have Dr. Mencia figures he has to do something here. It's 954-489-1345. And what does that number do? Well, if you call that number and you ask to have an appointment in the dental department, you will probably get Mike. I'm not sure, but you may get Mike.
Mike has a direct number too.
Oh, okay.
Yeah, he's now up on a.
Oh, okay. Well, we're going to give your number because we can't give too many numbers. Let's just give the number of 954-489-1345. That's the Adult and Gereatric Medical Center. It's in Commercial Boulevard. And what will happen is you'll make an appointment. Now, you do want to see Dr. Mencia for your flu shot, because we always have to tell you that. The pneumonia shot, if you want an excellent physician, he will be there, but he has so many other people on his staff. And so we have a podiatrist, and we have of course, we have the nutritionist, the dietitian nutritionist, we have a cardiologist, and we have the let's see. We
pain
also have
the psychologist.
A pulmonologist.
Yeah, pulmonologist.
That was very important for me this morning.
I need my pulmonologist.
Okay, but the thing is this: let's really carry on with the dental, because they are spending a lot of money when they're opening their new center over there in Boynton Beach for a big dental office also. So this is a one-stop shop, and that's what's always been wonderful. That's
but
what Dr.
Mencia.
You know
what's the beauty?
What's the beauty?
Dr. Caitlin, Dr. Steven, Dr. Rosemary, Dr. Fadi, they welcome people to come in as a walk-in. So if you have a walk-in patient,
you walk into a dentist's office.
To a dentist's office.
Not 3-week wait.
Not 3-week wait. You walk in. You have, we have so many dentists now available. Dr. Kaylin and myself, we live 10 minutes away from the office, both of us. So even sometimes we get called from the emergency room, and they say we have a patient, they need a dentist, and we'll go in on the weekend. If it's an emergency that we need to see you, if we are both available, we'll be more than happy. And Michael have done it numerous times to come to the office. A couple of Saturdays ago, we had a patient that came in, and it was an emergency on a Saturday. And one that came in, and we took care of the patient, and the patient was so happy. So just like in the medical side, people have a medical emergency. Instead of going to an urgent care that they don't know you from a hole in the wall, come to the practice. If you have a medical emergency or dental emergency, walk-ins are welcome.
Excuse me. We always want to talk, though, about what is sleep apnea. I mean, it's one thing to say, okay, you got to come to the office, but help people know, for them to dissect, for them to diagnose? Why would they even want to come and ask you for that?
Well, with sleep apnea, what happened is the airway or the pipes where the oxygen is going to go down to reach your lungs so that the lung can transmit that oxygen to the blood vessels, and then the heart can bring that oxygen to the brain so you can think the next day and you have all the energy, and that oxygen will go to all of your organs and including the muscles so you have energy to walk and move around. When a person have a sleep apnea, they are closing momentarily, completely shutting down their breathing mechanism. So they stop breathing for periods of time. And that lack of oxygen will do several things. Number one, will make you prone to heart condition. Number two, will make you highly prone to having a stroke. Number three, will make you very highly prone to have high blood pressure. A lot of people with sleep apnea end up taking high blood pressure medication. And usually we say it's unknown etiology. We don't know why you got this high blood pressure. But when you treat the sleep apnea, then we notice that the real cause was the sleep apnea. So there are many complications to sleep apnea that people go and get treated. And that's why you see so many people in this country, they take an average of 8 medications for different conditions. And you and I were always talking, why can't we just get to the root of the problem, where we can take the people off from all this chemical and let them live a normal life? So sleep apnea is the high blood pressure is just the branch of the problem. The fatigue that you wake up is another branch. The chronic fatigue that you have, the heart condition, the mini stroke. These are all branches of the same tree.
That's amazing, isn't it?
And just think, you might have heard recently about car accidents and things. Just think about, now all truckers are going to be required to take sleep apnea tests. Think about, I'm guilty of this, driving home. I said my best sleep is driving home sometimes. Just think about people who don't sleep all night long. I'm not kidding. Just think about how many people around you are in that same situation that only got a couple hours of sleep the night before.
Yeah.
And they're driving trucks, they're flying planes. So this is a big problem. There you
but you're absolutely right. And so you're saying that they don't really even realize they're not sleeping.
They
at
don't
night,
have
do
no
they?
idea. The patient we just did, it's actually a spouse of someone that works at the office. He stopped breathing 37 times during his sleep test. 37 times. This could affect the brain, or he cannot wake up. It's just amazing what this poor guy's going through. He doesn't eat right. He doesn't sleep at all. He has 2 small children. He's 40-something years old, her husband. 40-something years old. And this guy, unless he does something, he's on a CPAP right now as of just the other day, and he can't wear an oral device. He needs a CPAP. But just think about how many people around you, when you're driving, come up to a light and you see somebody, tired and stuff. I've done it. And this is why, those big accidents, remember Tracy Morgan and stuff? These are people who drive way too much. They get no sleep, and it's sleep apnea. So it has to be addressed.
So this is a whole new thing. And, now just to finish it off here, Caitlin Ferguson, our wonderful new dentist here with the Adult and Gereatric Medical Center, working very closely with Dr. Andy Mencia, and of course with Mike Redpoll. And of course we always have Ina, who will take care of it. If you don't like what's happening there, just get a hold of Ina, and she'll make it happen. She'll fix it. She fixes everything. Excuse me, Caitlin.
And, if you want to call directly to the dental department, so they have the number too. It's 954-489-2517. But when you call the main number, there is a live operator that will get a hold of Kaylin or Mike or myself or the live operator. The main number to go, you will get the live operator line. If it's not an emergency, you can call the other number. And
you're open on Saturdays.
And we are open on Saturdays.
Very important. They're open on Saturdays. You do make home visits. And also, the other exciting thing is they will be opening up in Boynton Beach. But don't wait. If you need medical care, go now, because it won't be for probably another month. So
we're getting people coming from Boynton down.
You have
Yeah.
been, I know, and that's
And,
one reason I think that you
right.
decided to move up into Palm Beach County.
Yes.
It's going to
absolutely.
be very exciting. We're all thrilled about this, and you will have a big open house, I know.
And for the people that have fear of dental care, I'm talking from the feedback. So even Dr. Kaylin don't know, but I get the feedback from my patient when they come back. She have a very soft hand. I mean, tell me about the
I can see this.
anesthesia that you guys are using, that go drop by drop. I mean, that's really cutting edge stuff.
Yeah, so we have we are equipped with the wand system, which is great. It's basically syringe free, and we get great feedback from the patients. You can get we can get you numb without you having your tongue being numb, your lips not numb. You can still smile. You can go back to work and you can talk. And it's just that one tooth that we need numb. We can get that numb in a matter of minutes.
That's
without
great.
a traditional
So
syringe.
syringe free. I mean, I
Syringe
remember
free.
when they put a syringe in there, and then they push the anesthetic. And with this equipment, it's got drop by drop, so the anesthetic is getting in so slowly that it doesn't bother you, like when they do it with the syringe. I mean, you know how I love to have stuff that are cutting edge and
I know.
efficacy.
I know, you're
And we
great.
get all of that.
And unfortunately, we have run out of time, as usual. You
Dr.
can't bring
Kaylin
5
Ferguson,
people.
thank you so much. We'll
Just-
bring you back.
Thank you.
We'll be happy to have you back.
In 30 minutes is tough, but Dr. Mencia, as usual, you're
And
very...
Ina was talking so much. I mean, Dr. Lesko.
Well, she's here, and we know that she's...
we had to
Yeah.
put tape on her mouth. Thank you, Mike. Thank you.
Yeah,
Kaylin,
thank
for
you.
coming.
Thank you
Dr.
very
Mencia.
much,
Thank you,
everybody.
Anita.
Glad to meet you, Caitlin. We're looking forward to big things. So we're going to go take a break, and then Joe Karp is going to be coming, our elder law attorney, who probably ought to think about sleep
Oh, no, the
apnea.
lawyer is coming. The lawyer is coming.
Yeah, well, he doesn't do that kind of law. He's
No,
an
no,
elder
no.
law
He's a good-
right.
he's a
He's a
great
different
lawyer.
kind of a guy, but maybe he even has sleep apnea. We don't know.
He had to come and see me.
Right. Okay. So we'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.